Hi, everybody. Welcome to Let's Talk Lake County. I'm your host, David Rich, here again with the wonderful Jennifer Banek, Lake County Coroner. Hello, Jennifer.
Hey there, how are you, David?
Good, good, good. Okay, so this is important because last time you were on, about a month or so ago, we discussed briefly, I think, towards the end, as you were updating us just on what your office was up to, this issue with that hospital Vista in Waukegan, and it got into some shenanigans there. To say the least. And then there was, at least a couple conferences with you describing what happened. So I know that there's been some sort. I got an update the other day, whether it's legit or not, I don't know, or even like fruitful, I don't know. So why don't you let us know what's going on there?
Yeah, so just to catch your listeners up to speed, while I'm the Lake County coroner, I'm also trained as a certified registered nurse anesthetist. So I put people to sleep for surgery. So periodically, we call it PRN, or on an as needed basis, I would work at Vista Medical Center in the surgical services department. And I had worked there since July of 2022 and had some concerns about some there were a lot of providers that were leaving, which then subsequently affected patient care, in my opinion. And so I was reaching out to people in positions of power to let them know that I had some concerns, and I think that it warranted further investigation. Ultimately, I did file a complaint with the Illinois Department of Public Health, and through their investigation, their Vista's trauma center status was revoked. That was around the beginning of February of 2024.
Wow.
Then Monday of this week, the trauma level 2 designation was restored to Vista. So that's a summary of, I'm happy to answer more specific questions, but so as of right now, the level 2 designation is restored to the facility.
So it has been. So what ailed the whole situation has been remedied.
Correct. They have remedied. They now meet at least the minimum statutory requirements.
Why were the people leaving in the first place? I mean, what happened?
So I think there were a number of reasons, but I will say the primary reason was that many of the contracted staff and so contracted staff were not getting paid. This was also an issue with some vendors that worked for the health system, so they weren't being compensated for their services.
Yeah, you need to pay people. That's how that's how an
Yeah.
economy was. What was Vista's response like? Did they say why? Was it some sort of like, were they out of money? Was it a glitch in the system? I mean, were they just
That's a
being
great
rude?
That's a great question, David. I actually, the beginning of December, there was an intergovernmental meeting, which is held quarterly. And I want to be clear to your listeners that um, I never went to the press initially to talk about this. Actually, like some documentation, the documentation that I had used, the letter that I had written voicing my concerns, that was leaked to the press by somebody else. Indeed, then once the press reached out to me, I did, respond, but I was not. My intention was to go through traditional regulatory bodies.
Oh, right. Okay, gotcha.
So. So folks were not getting paid, and I had heard that that was happening. I asked at this intergovernmental meeting the chief executive officer that I had concerns about their ability to recruit and retain talented clinical providers when it seemed that they were having difficulty um, uh, meeting their financial obligations. And her response to that question was that American healthcare systems had never missed a payroll. Well, that is not really a complete answer to my question.
Right.
Payroll would infer that you are talking about W-2 employees where the health system actually would pay the payroll taxes on the employee's behalf. It's a benefited employee. So the folks that I'm talking about were contracted clinical providers and other vendors who would submit invoices. So I was listening to another, I think it was in Chicago Business. I was listening to, an article that they had published, and the CEO had said that during the purchase and the transition, things had fallen through the cracks.
Okay.
So
Some sort of systemic issue.
seems that way.
If they're okay, all right, seems that's it. A lot of things seem certainly. Okay, are you not buying that?
Uh, you know, when you purchase an entity, this is a very, a process that would involve forensic accounting. When
Okay.
a private entity would come in, they would see the book of records, to be able to analyze the health of the institution. There have been 2 town hall meetings. The first town hall meeting, the owners stated that they didn't know what they were getting themselves into. The expenses were higher than they expected, and the reimbursements were lower. I would expect that during that forensic analysis, accounting analysis, that those things would reveal themselves. It was also mentioned in that meeting that contracts with insurance companies for reimbursement had not been negotiated in 10 years. Usually those contracts are 1 to 2 years. So yes, not renegotiate. I mean, but I would expect that you would know this going in. And my expectation, David, would be instead of simply not paying people, you would terminate a contract.
Okay, yeah, I mean that seems like a reasonable first step. And well, I'm just curious, is how it went, how many people that weren't getting paid, for how long were they saying? I'm assuming they said something like,
When
"Hey,
it
where's my
started,
money?" You know?
when people started noticing, it was around the 6-month mark.
Wow.
And a lot of contracted folks that work at Vista, they will work at other facilities. So it wasn't that income that they might have been necessarily dependent on. And admittedly, there are a lot of Medicare and Medicaid patients, which are the lowest reimbursed insurance policies. So, I think people that work at Vista worked there because they enjoyed it, like myself. They loved working with the patients. These patients need access to good healthcare, but the fact that
Sure.
they weren't compensated rapidly, they kind of knew that this was a little bit. This was part of the challenge, but that only lasts for so long that people are willing to be tolerate not being paid. Yeah, so
It's just out of the good graces of their own wonderful heart that they stuck around for that long without getting paid. It's the Hippocratic oath, I guess, and that's wonderful. I mean, it's nice to see that sort of ethic in the healthcare field. It's nice to know that people actually, care about people over money, but still, it's a job. You need to get paid. I get that.
well, and the problem was that my understanding was that several of the providers had tried to engage with the chief executive officer, Bianca DeFilippi, and had a difficult time engaging with her. She seemed quite elusive.
That was the person I saw in that interview, Deep Philippi, because I remember it sounded like a nice Italian name.
Yeah.
My family's from Italy, so I note those things. But okay, have you had any conversations with her or anybody else, in the higher ups, directly about this thing? I mean, how did the actual the situation go as far as who talked to who to make sure things happen?
So after that intergovernmental meeting, the mayor for Waukegan was present
Okay.
at the meeting, and so was Senator Adrian Johnson, and then a representative from Representative Mayfield's office. Those 2 legislators in particular, the hospital sits in their district, so they were present at the intergovernmental meeting.
Okay.
When I tried to engage, asking about the difficulty meeting financial obligations, it's a little challenging. People certainly don't have to answer your question. So right. So I didn't feel like I was getting an accurate answer. After that, Mr. George Bridges, who's the chief deputy to the mayor of Waukegan, and also sits on the board for Vista, asked me to write down my concerns, which I did. The next board meeting was going to be December 18th. And so over the course of a week and a half or so, I wrote down and articulated my concerns, gave it to Mr. Bridges. My expectation was when I gave that letter would be shared with the rest of the board members. Unfortunately, that letter was only shared with the CEO. Certainly the CEO could have been included in that group, but many of the concerns that I had related back to the administrative decision making. So I don't know that it would be terribly helpful to give it to that one person exclusively. It wasn't until the end of December when another board member was made aware of the letter that I had written and asked me for a copy of it. And then that board member, Mr. Rick Harris, said, "Gosh, I never have seen this. I've never seen this letter." I realized that the rest of the board members had never been given a copy of the letter. And Mr. Rick Harris actually asked for an emergency meeting of the Vista board members so that they could address some of the concerns in my letter. Mr. Harris had said that, during a Zoom meeting, there were several clinical providers who had interrupted the meeting, so to speak, and also were complaining that they had not been paid. I think that Mr. Harris would agree with me when I say that it seems like there was smoke, and then with my letter, there was fire. So, so that's why he then requested the emergency board meeting. I should mention that the Vista board it's a community board. As I was looking for folks to report my concerns to, I thought the board made sense. I think that it's important that your listeners know, however, that the board doesn't have a lot of power. They do not have the power to, for instance, hire and fire the chief executive officer of the company. They don't, what they do is they actually review credentialing files. So for new clinical providers, they go through a process called credentialing, and this board reviews credentialing files, but they really don't have a whole lot of power.
How does somebody get on the board?
That's interesting. I actually was interested in being on the board myself. I think that, and many people have said, gosh, Vista has had problems for a long time. I think that's true. Even from when I first came, I noticed issues. I will say that since American healthcare systems took over, I had never seen some of the things I had seen in my almost 20 years of healthcare, in the healthcare profession. So it was markedly different. So because I noticed that it was a challenged system, I actually tried to get on the board. That was something that I had spoken to multiple folks about, the mayor of Waukegan, George Bridges, for instance, one of the aldermen, and said that I was interested in being appointed. It's a volunteer board. So there was no motive, because it was, there were financial rewards for serving on the board. But I felt like I had a unique background as a clinical provider myself. I've served in the military for over 15 years. I'm an elected official who cares about and is passionate about the community. Healthcare is complicated. And I thought I would bring a unique perspective to the board. So I actually tried to be appointed to the board by asking people and by expressing my interests. I still have an email that I sent to Mr. Faisal Gill, asking him if I could be appointed to the board, because frankly, I wanted to help.
Very cool. All right. So as far as being reaccredited, as of now, does that include that they've compensated for lost pay and everything else? And is there any sort of legal penalty on that? Do they have to pay a interest rate or anything? Never go to trial. Anybody is there any legal action?
Not that I know of. I would defer that to American healthcare systems. Yeah.
Oh, okay. Okay. But they're back up to staff level. That's part of the reaccreditation, or also defer to.
Yeah, I would defer to them. They are up to whatever's required by the Illinois Department of Public Health. I don't know if they are fully staffed. I would talk to them about their staffing levels.
They're still open and running.
It is yes. I should. Yeah, It's really important to know that it's still open and running. Absolutely.
Okay, good. And no. I'm assuming that there's a set of standards and stipulations by which you have to become reaccredited by, and if you don't meet them, okay. So, and hopefully it's a proper set, and so that's good. Well, okay, because there was all sorts of stuff going into this whole thing, and it was just really remarkable to hear and unfortunate that this is happening in a hospital. I mean, you sort of have like a reasonable expectation that hospitals run, efficiently. So so when you hear about this, it's so good for you for bringing it to the public's attention, because I think it's something that people should hear and be able to make a decision. I guess unless it's an emergency, if they want to go to this hospital or not. Um, you know,
I think
right?
it's really important for folks to know and understand that I feel very passionate about the fact that the Waukegan community and the communities, the surrounding communities that Vista serve, absolutely need a hospital, and a hospital with a trauma center
Oh,
designation. Um, you know, some of the things that I saw, I was in a unique position because I'm a clinical provider and I sit in an elected office. And so it really quickly gave me a platform to be able to describe these things. And you almost had to have somebody be that combination. It's not up to the community to police their own healthcare in terms of knowing what clinical standards are, right? but
right,
but I am kind of a niche subject matter expert in those things. And
right.
so but I feel like it had been longstanding and there were some questionable things that had happened. And my hope would be that from now on, if patients or staff have issues or concerns, that people will be paying attention, now that it's been brought to light.
Yeah, absolutely. Do you feel as though if like the response of the administration in Vista, has it been positive? Like, yeah, you're right, we messed up, let's fix this together, or has it been like a whole lot of resistance? You did mention the CEO wouldn't kind of talk to people or whatever.
Right. So the first town hall, I mentioned that I felt the common theme was we didn't know what we were getting into.
Right.
The second town hall, I felt the common theme was we knew what we were getting into, but we were the only buyers, and the community wouldn't have a hospital if we didn't buy it. um, the first town hall, community members were told that the books were open. Anybody could look at their financial accounting. And the second town hall, that wasn't so much the case. So I think there was a lot of inconsistent messaging.
Okay. And all the talk of like, uh, uh, having it taken over by the local government, keeping it privatized, selling it, that's all gone now. That's all done because it's
Uh,
reaccredited, or is that
well,
still a thing?
first of all, it is a private entity, so they
Right.
would need to be willing to sell it. Um, but, I mean, looking at, having it as a county hospital, I think that given the circumstances, that sounds quite appealing. That being said, I think our county board, who manages the purse strings, says, I don't know that we have the funds to do that, right? Um, and
Right.
so, this is the challenge of healthcare, I think nowadays. But
Oh yeah. That's a yeah,
my
yeah.
my concern is that if there were to be any additional source of income or support, my concern would be transparency and keeping a finger on a pulse where those funds are being spent.
Very interesting. Yeah. No, that is definitely an underpinning to the debate and discourse concerning healthcare, definitely in this country. I
So,
just had a go ahead, sorry.
well, it's an interesting dynamic. Like, Vista is a for-profit hospital, which sounds a little counterintuitive. Hospitals like Condell and Lake Forest are not for profit. There is a trade-off. If you are for profit, you pay property taxes. If you are for profit, your books are not transparent, right?
Oof,
So,
oof.
um, whereas a not-for-profit, there is a form called a 990 form that you can look, and you can there's a lot more transparency in terms of the operational machinations of the accounting and such.
All right, cool. I love that word, machinations.
It's a
Um,
cool word, right?
it's a
Yeah.
very cool word. Instead of just saying the mechanics of, say the machinations. But no, it's really interesting. I mean, yeah, and maybe we can come up on and another time and talk about like political philosophy and economics and stuff like that, but especially in healthcare because that is a huge deal. I've studied both, free market private ownership models and socialized models, and in my humble estimation, I still think the socialized models are far more efficient than the other ones. Like far more efficient. But
You know who seems to have figured it out is we just had a lecture on actually Singapore actually has a very interesting healthcare system where they seem to have found that just right, the Goldilocks, the just right balance,
yeah.
cost and healthy lifestyle. So kind of interesting.
I'll have to check that out for sure because I'm always interested in this kind of stuff. Yeah, and there's a multitude of different options, by the way. Like for example, Norway, like it's all privatized, but if you're going to open some sort of healthcare clinic or hospital, it has to be not for profit. It has to be. So it kind of like helps, shape the efficiency of that system. In Canada, they basically everything's privatized. It's just Canada is like the main is the insurance company. Basically, you just bill the government pays. So they got rid of the whole middleman. Insurance companies are a disaster. Anyways,
Yeah.
whatever. Okay, we'll talk about this later. Go ahead.
Well, I was going to say Singapore's key to success, it seems to be that everybody is mandated to have a healthcare savings account,
Oh,
which is
that's another way to do it too. Yeah,
yeah.
100%. Yeah,
So
yeah.
I don't know that Americans would respond so well to that mandate. But in addition, we have lobbyists here that you mentioned the insurance companies. So
Yeah, no, but like even like if you had a system where you kept the insurance companies, having an account mandate is a pretty interesting thing, and probably is effective because then you can lower the cost of your insurance premium because you can get just like kind of like a low level insurance plan, pay $150 a month because you have 20 grand saved up for that massive deductible that you would have to pay if something goes badly wrong.
right.
So no, that's a free market solution, and that's cool too.
Yeah.
So yeah, okay. So it just really depends. We just all need to get on the same page and figure out what we want to do. So yeah, because our current system in this country is extremely inefficient. So anyway,
Yeah.
all right. Well, anything else you wanted to add? Any questions I didn't ask that you think are important? Or
No, thanks for the opportunity to come here and
yeah.
and talk about it.
No, thank you. It's this is really important. I'm glad I found out about it last time. Because I sent it out to a lot of people in the area and nobody knew about it. They're
Oh,
like, what's happening? So
yeah.
so that's very cool. Help spread the word about what went on. I'm glad that we made steps forward. That's great. And thank
All
you
right.
again for your efforts in this because without you this wouldn't have happened. So thank you so much.
Well, thanks, David. Take care.
All right, you too. And hang on
Okay.
one second. I want to ask you a question of the show. Thanks for tuning in to Let's Talk Lake County, everybody. See you next time.